In this video, let me talk about the mental illness, the causes and the symptoms and the prevention of mental illness. The definition of the mental illness is a maladjustment in living. Mental illness produces a disharmony, means no harmony, no peace, in the person's ability to meet the human needs comfortably or effectively, or function normally within a culture. Mental illness is a condition in which an individual fails to fulfill his roles and carry out the responsibilities, whose behavior is inappropriate to the situation. What are the causes of mental illness? It is categorized under three headings: primary cause, predisposing cause, and precipitating cause. Primary cause. It is a condition without which the disorder would not have occurred. Example: in head injury, the primary cause is trauma. This results in transient, temporary, organic, psychotic conditions. Predisposing cause. It is a condition that comes before the disease has occurred or psychopathology has appeared. It will interact with precipitating factors to result in mental illness. Thirdly, precipitating cause. These are events that occur shortly before the onset of a disorder or disease and appear to have induced it. Example: death of the father of an adolescent boy may lead him into depression. Including primary, predisposing, and the precipitating causes, following are the causes of the mental illness: A. Biological factors, B. Psychosocial factors, C. Sociocultural factors, and D. Neurobiological factors. A. Biological factors. Biological factors influence our behavior to a great extent. Example: our intellectual ability, coping ability are affected by different biological factors. Number 1. Genetic factors. Faulty genes refer to chromosomal defects. Chromosomal increase or decrease may affect the development of the fetus or unborn child. Example: Down syndrome, manic depressive psychosis, that is MDP, and schizophrenia in dizoic twins. 2. The physical handicap. Physical handicaps like blindness, deafness, lameness, means unable to walk, affect the self-concept of an individual, and these are stressful conditions for adjustment. A person with physical handicap socializes very less and may develop feelings of inferiority, self-pity, and sometimes hostility, which means bitterness also. Thirdly, physical deprivation. Deprivation means loss. This includes malnutrition and sleep deprivations. Severe malnutrition affects the physical and the mental growth of the infant and may cause infection and mental retardation. Sleep deprivation and the fatigue, tiredness are very common in depression and anxiety. Fourthly, disruptive emotional process. Emotional factors also cause many mental disorders like psychosomatic or conversion disorder. B. Psychosocial factors. Number 1. Maternal deprivation. Means the child is deprived of maternal stimulation of mothering. Might be separation of the child from his mother is bound to affect his growth. Inadequate mothering affects the growth and the behavior of a child. Secondly, pathogenic family. Pathogenic means it is a cause for something. Faulty parent-child relationship also affects behavior of a child. Rejection by the parents may cause feelings of anxiety, insecurity, and low self respect or esteem. Overprotection may result in submissiveness or low self esteem. Submissiveness means something always obeying and something obeying everything totally and leading to a low respect, self respect, while harsh, strict discipline may produce fear, hatred of the parents, and lack of friendly feeling. Thirdly, pathogenic interpersonal relationship. Children of pathogenic interpersonal relationships in disrupted families like marital disharmony, no peace in the marriage, or broken homes go through a lot of stress. Example, they may develop delinquency. Delinquency means it is crime and abnormal behavior in the adolescence. Severe stress is the fourth one. Stress is also the cause of the abnormal behavior. Stress can be caused due to any factors sociocultural, biological, and psychological. Example, failure in studies, in job, in adjusting to the marital life. C. Sociocultural factors. Sociocultural factors influencing the development of abnormal behavior or mental illness and as follows. War and violence is the first one. War and violence, due to the various reasons, leave an effect on the mental health because due to the stress of war and the violence, people have lots of psychological problems such as fear of death, insecurity, etc. 2. Economic and employment problem. Economic and employment problem is another contributing factor to mental illness because employment causes frustration and stress and may result in suicide, homicide, anxiety, and depressions. D. Neurobiological factors. The major category of transmitter substances are as follows: monoamines, amino acids, and peptides. These transmitters, neurotransmitters, imbalance means whether it is increased or decreased causes the mental illness. Example, decrease in the norepinephrine, which is produced by the adrenal gland, and the serotonin, this is the pathway of that. This causes the depression, while excess of dopamine causes schizophrenia. Symptoms of mental illness. The person behavior is causing distress and suffering to self and others. The person's behavior is causing disturbance in his day to day activities, job, and interpersonal relationships. Especially the social and the vocational dysfunctions will be there. Changes in one's thinking, memory, perception, feeling, and judgment resulting in changes in talk and behavior which appears to be deviant from previously personality or from the norms of the community. These changes in the behavior cause distress and suffering to the individual or others or both. The prevention of mental illness. In the 1960s, psychiatrist Gerald Kaplan described levels of prevention specific to the mental illness. These are as follows. Primary prevention. Primary prevention seeks to prevent the occurrence of the mental disorders by strengthening individual, family, and grouping coping abilities. Secondary prevention. It targets people who show early symptoms of mental health disruption and include early diagnosis and treatment. Tertiary prevention. It targets those with a mental illness and helps to reduce the severity, discomfort, and disability associated with their illness. It includes monitoring the progress of the discharged patients, medication regime, and coordination of the care, etc. Related topics available in the description.